Hello, my name is Shantice Beecham. I will be presenting the top 10 problems of acute renal failure. For the top 5, we have created a plan of care. Problems of the top 10 problems include excess fluid volume, imbalanced nutrition, impaired skin integrity, constipation, and risk for injury. Risk for infection, medication noncompliance, knowledge deficit, impaired social interactions, and fatigue. For our first plan of care, we will discuss maintaining fluid and electrolyte imbalance. With the fluid and electrolyte imbalance, we want to ensure that we maintain a strict INO. This will include keeping up with what they eat and drink and how much. And sometimes these acute renal failure patients are on a fluid restriction. Sometimes it's 1,000, 15. It depends on the weight, and it also depends on the doctor and how well their kidneys are perfusing and functioning. We also want to monitor serum and electrolyte imbalances. We want to do this because oftentimes when we have fluid overload, they go into fluid balance overload, you will have an increase in serum sodium or potassium, which we know we would then want to monitor our ECGs because it could cause problems within the heart. We also want to monitor vital signs, ensure that the blood pressure is not increasing or decreasing too rapidly, because if the blood pressure drops too low, we know that then our kidneys are not being perfused properly. We want to avoid using dialysis access extremities. We want to do this because we consider this as their lifeline. Anytime they have an implanted device for dialysis, usually they'll have a graft or a fistula. Sometimes they'll have central accesses. But what this does is it allows the blood to be pulled off. We don't have to go through the full dialysis process, but anytime we manipulate that, we have a chance of creating a malfunction, and we definitely don't want to lose that lifeline. Our next plan of care will be to maintain adequate nutrition. Because the kidneys aren't working as they should, as properly, sometimes they have a hard time excreting the things that they should excrete. So we would get a dietary consult to begin with for our dietitian to tell us what they can and cannot have. And one of the things we would want to put them on would be a high protein diet. We also want to include a diet that would be high in carbohydrates. We would want to weigh them daily. This would ensure that they're not holding in too much sodium, which would then pull fluid with the sodium, which would then cause them to have an increase in the weight. So if we monitor this daily, we may be able to catch it early on. We also want to monitor our lab values and avoid certain foods, such as foods high in potassium, as I mentioned, and foods high in sodium. Our next plan of care would be maintaining skin integrity. We want to keep the skin clean. We want to provide ointments and creams for them. Keep the nails short. We also want to keep their hair clean and use antihistamines. Now, we want to keep the skin clean. Well, everyone should keep their skin clean, but especially in these patients, because they have an increased risk for infection. And anytime we have scratches, and that coincides with keeping the nails short, if they scratch, they may cut their skin, which could lead to bacteria, a bacterial infection. We want to give them ointments and creams to provide moisture for their skin, because sometimes they have a buildup in uremia and toxins that normally your kidneys would excrete, but since they're not working properly, we can't excrete those, and it causes our patients to have itchy and dry, scaly skin. So we want to prevent that, and it's kind of like a comfort measure as well. Our next plan of care would be preventing constipation. Some of their medications and foods that not having, being on fluid restrictions sometimes, you're not getting enough water or have you. So we want to maintain and encourage high fiber diets. They could have fruits that are not so high in potassium but are high in fiber. They could take fiber supplements. We can also give them stool softeners. We want to try to avoid laxatives, however. And increased activity. Increased activity also wakes up your gut. Our next plan of care would to ensure safety. We want to monitor our serum calcium, monitor gait, range of motion, and muscle strength. We want to monitor that calcium because it's in our bones, and if they're losing the calcium, then it's an increased chance that they'll have muscle problems. We want to monitor gait and range of motion and muscle strength, as I mentioned. We want to use analgesics for pain and increase activity as tolerated. Also, make sure you're giving them their medication as ordered and as needed, as they ask for it. Expected outcomes: fluid and electrolyte balance. They will have adequate nutrition, no skin excoriation, decreased or no constipation, and most of all, no falls. You know we want to keep those patients safe. And these are our expected outcomes for our 5 plan of cares. And this is where we retrieved our information from Lippincott Manual of Nursing Practice. I thank you for spending time with me, and hopefully you enjoyed and learned something that you did not know about acute renal failure.